Narayana Health City advances cancer care with landmark CAR-T cell therapy success. Breakthrough CAR-T cell therapy proves life-saving for South India's first patient. Bangalore, 21st May 2024, Narayana Health City, Bangalore recently held a press conference to celebrate a remarkable victory against cancer. Highlighting the institution's strides in advancing cancer care, Hamza Khan, a 42 years old man from Bangalore, trumped over relapsed follicular lymphoma, a cancer of the lymph nodes. Following a challenging journey that began in 2020, the COVID-19 pandemic. Notably, Hamza is the first patient in South India to receive the novel CAR-T cell therapy, a breakthrough in cancer treatment.
Session we've organized. So recently, I think even in the media, you all would have been, hearing news, and you all have been actually publishing news about immunotherapy. So everybody in cancer treatment now is talking about immunotherapy, which means we are moving away from chemotherapy, which was the standard treatment for cancers, which has a lot of side effect and toxicity and all that, and people are talking about immunotherapy. The big highlight of immunotherapy is trying to use your own cells to fight the cancer cell and destroy the cancer cell. So that's the newest treatment, and then we've been seeing news about various centers trying to start this, and India is now coming into the forefront of that. And the newest form of treatment in that immunotherapy is called CAR-T cell therapy. It's called chimeric antigen receptor T cell therapy. That is, what you do is you take the cells from the patient, the T cells, you collect it when they're well, change one receptor so that can identify the cancer cell, and then put the cell back. Then that will go back and kill the cancer cell in the patient. Okay? So now this is the latest form of treatment for cancer everywhere in the world, and in the US, a lot of patients have started getting this, but it is something which is horrendously expensive in the country. And for us to be, for it to be affordable to our patients, we needed it to happen in our own country. So unless production and treatment happens in our own country, the cost will not come down. And the classic example is for bone marrow transplant, which we anyway got proof now that earlier what used to cost 1 to 2 crores in the US is now available for 1/10 of the cost in our country. And there are close to about 100 centers in the country doing bone marrow transplant now. Even 20 years ago, when I started out my practice, there were less than 10 centers in the country who could do bone marrow transplant. So using that same analogy and example, we are now saying that this treatment is also available for our own patients, and clearly we are seeing now the benefit of that. Now, looking back on the treatment, Mr. Khan will tell you what exactly he had to go through. So, all of us remember our COVID pandemic, everybody was troubled, we were keeping, social distancing, masking, all, housed up in our houses, locked down. So imagine what happens to a patient who during that time gets some disease like this. If you have a disease like cancer, you can't sit at home and say, I will not do anything, you need to get treated, And he's somebody who went through that kind of treatment, then came out of that, but unfortunately had a relapse again, and when it relapsed again, even the chemotherapy treatments were not working. So at that time, we got him to, come into our center, and at that time, this kind of treatment was being initiated for the first time in the country, and he was eligible to kind of undergo that treatment, and his cells were collected and then put back, and he's now one of the longest survivors now, definitely in the state for sure, that I'm sure. He's also one of the longest survivors in South India, because there's no other patient from South India who's got this kind of CAR-T therapy and gone beyond, I was actually going to say 1 year, but just last week he crossed 1.5 years, and his recent tests and blood scans and reports and all are absolutely normal. So in diseases like cancer, we have milestones, so everybody talks about the first 6 months survival, 1 year survival, 2 year survival, and then you want longer 5 year survival, and after that it's basically cure. So we are looking more and more towards that kind of, milestone in him, and that's why it's a big moment for us to say somebody who's crossed that, first of all, the 1 year landmark, and now he's actually beyond 1.5 years, So looking at that success, we want to say that this is something which will be available for patients in our own country, who cannot even sometimes tolerate chemotherapy. If you have an elderly person with a lot of comorbidity who is not controlled, then giving chemotherapy to those kind of patients is very, very difficult, But here, this is something which is very easily done. You're just taking your own cells, changing that receptor, putting it back, and then those cells will go and kill off the cancer cells, leaving the good cells intact. So there is no side effect. That carpet bombing kind of treatment does not occur. You're target shooting here and killing only the cancer cells. Okay. So this is the story of Mr. Khan, and that is something which we wanted to highlight and bring forth, so that this treatment, which should now be available for more people in our own country with better success rates and better cure rates, is what we wanted to highlight here. So more such story we will actually get from him from Mr. Khan himself, so that he can tell you what all he had to undergo to actually come out and stand like this in front of you all today. So I will stop here and allow Mr. Khan to then talk to you all, and then post that we will address whatever questions and queries you all have to regarding either the treatment or its success rates or all these kind of things. Okay.
So this is 1.5 years in immunotherapy. So as the disease itself, if you consider, it is around 3.5 years. So before specifically, so the normal treatment regimen I underwent in one of the leading hospitals in Bangalore. So it gave a result initially, but in a matter of 6 months, it relapsed again. And I was going nowhere. And one of my close family doctor has suggested that you have to go to the best, who is at the best in immunotherapy as well as the BMT. Then only I came across Mr. Dr. Sharadamodar. So I went to him. So before that, the typical regimen in chemotherapy was like you lose your hair, lots of side effects, you will not be active in your day-to-day life, and all that stuff I underwent for almost 2 years. Then after coming across Dr. Sharad Damodar and his team, then they have enrolled me into this CAR-T cell. So I would say, as far as the CAR-T cell therapy is concerned, not every patient can be enrolled. There are certain selection criteria is there. So I have crossed that, or I have passed that selection criteria. Then they have enrolled me. So my experience with this treatment regimen is, I would say, very, very limited side effects. Rather, I would put across 0 side effects, and I have started my day-to-day normal life. And then I usually followed the protocol also, while going through the protocol as well. There are no, I would say, the outcomes of the protocol was also found to be very, very normal. So I would like to express my, with a deep sense of gratitude, my heartfelt thanks to Dr. Sharad Damodar and his team.
To his Hajj, pilgrimage, which also was possible thanks to this treatment. 1 year after he completed, he actually went to the Hajj pilgrimage, did that and came back. On the way, developed a little bit of infection. Obviously, you go to a crowded place, you will pick up some infection. But he finished that also and came back, and you can see him now that he's well and fulfilled one of his wishes which he wanted to do, which otherwise with disease progression and being on treatment was something which wouldn't have been possible. So that's another thing which is a highlight for him. So everybody has something you want to look forward to, especially when you have diseases like this and you want to go through as easily and as well as possible and get back to a normal life. That's the intent of any patient who's undergoing treatment. And I think it is nice to see him telling you all this in person.
Yes.
ಸೊ ಈಗಿನ ಕಾಲದಲ್ಲಿ ಇವಾಗ ಕ್ಯಾನ್ಸರ್ ಕಾಯಿಲೆ ಮತ್ತೆ ರಿಲ್ಯಾಪ್ಸ್ ಅಥವಾ ರಿಟರ್ನ್ ಬಂದಿದ್ದಾಗ ನಮಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡೋದು ಭಾಳ ಕಷ್ಟ ಆಗುತ್ತೆ. ಆ್ಯಂಡ್ ಇಷ್ಟು ದಿವಸ ಬರೀ ಕೀಮೋಥೆರಪಿ ಮಾತ್ರ ಆಪ್ಷನ್ ಇರ್ತಿತ್ತು. ಬಟ್ ಇತ್ತೀಚೆಗೆ ರಿಸರ್ಚ್ ಎಲ್ಲ ಮಾಡಿ ಇಮ್ಯುನೋಥೆರಪಿ ಅಂತ ಇವಾಗ ಕಂಡುಹಿಡಿದಿದ್ದಾರೆ. ಆ್ಯಂಡ್ ಅದರಲ್ಲಿ CAR-T ಸೆಲ್ ಥೆರಪಿ ಅಂತ ಹೊಸ ಟ್ರೀಟ್ಮೆಂಟ್ ಇವಾಗ ಬಂದಿರೋದು. ಇದರಲ್ಲಿ ಇವಾಗ ಪೇಷಂಟೇ ಸೆಲ್ಸ್ ತೆಗೆದು ಅದನ್ನು ರಿಸೆಪ್ಟರ್ ಸ್ವಲ್ಪ ಚೇಂಜ್ ಮಾಡಿ ವಾಪಸ್ ಹಾಕಿದರೆ ಆ ಟಿ ಸೆಲ್ಸು ಕ್ಯಾನ್ಸರ್ ಸೆಲ್ಸ್ ಹೋಗ್ಬಿಟ್ಟು ನಾಶ ಮಾಡುತ್ತೆ. ಇವಾಗ ಆ ಥರ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಗಿದ್ದು ಒಬ್ಬರು ಪೇಷಂಟ್ ಇದ್ದು ಎಕ್ಸಾಂಪಲ್ ತೊಗೊಂಡು ಇವಾಗ ಆಲ್ಮೋಸ್ಟ್ 1.5 years ಆಗಿದೆ ಆ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟು. ಆ್ಯಂಡ್ ಅವ್ರ ಬಗ್ಗೆ ಮಾತಾಡಲಿಕ್ಕೆ ನಾವು ಇದನ್ನು ಆರ್ಗನೈಸ್ ಮಾಡಿದ್ವಿ. ಇವಾಗ ಪೇಷಂಟೇ ಬಂದು ಮುಂದ್ಗಡೆ ಮಾತಾಡಿ ಹೇಳಿದ್ದಾರೆ ಅವರೆಲ್ಲ ಹೇಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ ತೊಗೊಂಡು ಇವಾಗ ಚೆನ್ನಾಗಿ ವಾಪಸ್ ಕೆಲಸಕ್ಕೆ ಜಾಯ್ನ್ ಮಾಡಿದಾರಂತ. ಸೊ ಈ ಥರ ಟ್ರೀಟ್ಮೆಂಟ್ಗಳು ನಮ್ಮ ದೇಶದಲ್ಲಿ ಸಿಕ್ಕಿದ್ರೆ ಎಷ್ಟೋ ಜನರಿಗೆ ಉಪಯೋಗ ಆಗುತ್ತೆ. ಸದ್ಯಕ್ಕೆ ಅದು ಭಾಳ ಕಾಸ್ಟ್ ಸಿಕ್ಕಾಪಟ್ಟೆ ಜಾಸ್ತಿ ಇರೋದ್ರಿಂದ ನಮ್ಮ ದೇಶದಲ್ಲಿ ಅದು ಪ್ರೊಡಕ್ಷನ್ ಮಾಡಲಿಕ್ಕೆ ಶುರು ಮಾಡಿದರೆ ದೆನ್ ಇದನ್ನು ಎಷ್ಟು ಜನರಿಗೆ ಹೆಲ್ಪ್ ಆಗಲಿಕ್ಕೆ ಸಾಧ್ಯತೆ ಇದೆ. 2 weeks ಜನರಲಿ, 2 to 3 weeks.
ಸೌತ್ ಇಂಡಿಯಾದಲ್ಲಿ ಸರ್ ಫಸ್ಟ್
ಸೊ ಈ ಥರ 1.5 years ಟ್ರೀಟ್ಮೆಂಟ್ ಕ್ರಾಸ್ ಆಗಿ ಡೆಫಿನೆಟ್ಲಿ ನಮ್ಮ ಕರ್ನಾಟಕ ಸ್ಟೇಟಲ್ಲಿ ಇನ್ನು ಯಾರ್ದು ಆಗಿಲ್ಲ. ಸೌತ್ ಇಂಡಿಯಾದಲ್ಲೂ ದಿಸ್ ದ ಫಸ್ಟ್ ಪೇಷಂಟ್ ಹೂಸ್ ಹ್ಯಾಡ್ ಅ ಫಾಲೋ ಅಪ್ ಮೋರ್ ದೆನ್ 1.5 years ಫ್ರಮ್ ದ ಟ್ರೀಟ್ಮೆಂಟ್. There are few people who had treatment who are still in the second month, third month. But we want to wait at least for a year to say clear agide anta. That is why we waited. So generally 1 year is one milestone everybody waits to do a scan test to say that patient is well. He's actually crossed 1.5 years now, which is a big thing for us, and that's why we thought we should highlight that.
ಫುಲ್ಲಿ ರಿಕವರಿ ಆಗ್ತಾರೆ.
It is extremely low iga. See, he's somebody who's relapsed within 6 months. He's now 1.5 years well is something, it tells you that generally he's doing well. No, because with the first treatment within 6 months he told you, disease came back.